Is This Normal, Doc? A podcast sponsored by Tanner Clinic.
Welcome back to another episode of Is This Normal, Doc? The podcast where we talk about what's normal and what's not with the expertise of our Tanner Clinic providers. As always, I'm Hope and I'm your host. Today joining me as my co-host is Victoria. And today we're going to be talking about breast reduction. So if that is something that you are interested in, please keep watching and hopefully we can answer some of your questions.
This is Dr. Williams joining us today, and he is a plastic surgeon here at Tanner Clinic, and we're going to give him the opportunity to introduce himself.
Thanks for having me on.
Thanks for coming.
Great to be here. They mentioned I'm Matt Williams. I'm a plastic surgeon, just started here at Tanner Clinic just a few months ago. I grew up in Logan and went to college there at Utah State, and then went to med school in Vermont at the University of Vermont. While I was there, I joined the Army, so they basically paid for medical school on scholarship, and then went from there to El Paso, where I did general surgery first. Did residency in El Paso, and then worked as a general surgeon for a few years, and then went back to do plastic surgery in Houston. I was there for a few years doing plastic surgery training, and then finished, and then came back here to Utah.
I've been in your office. I've seen your military pictures. It's pretty cool to see.
But I've seen some of the surgery pictures. They're pretty cool.
Yeah, it was great. It was a great experience. Met some great people in the Army and deployed a couple times to the Middle East, which was really interesting. Yeah, it was a good time, but good to be done as well.
Yeah,
and,
nice to be home.
Glad to be home.
My family's liking that I'm not getting deployed anymore and all that stuff. Yeah. So, yeah, it's been nice.
We're going to get started with our favorite segment that we like to call Is This Doc Normal? And our first question that we have for every provider, and you as well, is who is your favorite fictional doctor?
What I think of that is usually TV or movies.
Yeah.
I probably, like most doctors, it's hard for me to watch doctor shows.
Are you saying they're not realistic?
Like Grey's Anatomy and ER, those kinds of things. So I'm not a huge fan. I guess I did like Scrubs when it was on. So it's comedy. That ran for a number of years. The original cast was really good, and John Dorian was the main. Yeah. Started off as an intern, and then he became back, and so I liked that show. And he was pretty funny. So
I think
John Dorian was good.
It helps that they don't take themselves too seriously too.
Yes.
You're probably like, let me give a little bit of leeway because it's a comedy.
Everybody asks if I like Grey's Anatomy, and because that's a surgical show, and they have all that kind of stuff. But I watched a couple episodes, and I couldn't do it. It was.
You're like, dang, this is not what it's actually like.
Yes.
I watched that show and I was like, maybe I could perform heart surgery. Like,
yes.
Totally.
Right.
You're like, please no.
Yeah, that's right. Yeah. So I think that.
I've taken a first aid class, so clearly I'm a doctor.
I could use a pen to do a trach and all that stuff. Yeah.
Okay. What is a skill that you wish you had, but you definitely don't?
Singing.
Singing
is something that I would love to be good at.
So you're not one of those. You're not one of those surgeons that's like bumping the tunes in the operating room
and singing along.
Huh?
Right. Yeah. I try not to do
or
that.
Or are you and you just know?
Yeah. I try not to do that for everyone else's sake. I try not to sing too much. I do like to listen to music, but whenever I listen to good music, I always wish I could be a better singer.
Yeah.
So you're saying you don't sing along in the car when you're driving into work?
Maybe by myself.
Yeah.
Yeah. My family, I have a daughter who's a really great singer. My oldest daughter, she was in the choir. And all of my kids, they do karaoke, but I'm not one of those. So I wish I was a
You're the
good
biggest
singer,
supporter.
But I'm not. I'm a supporter. Yeah, right. I'm a listener.
We had one of our providers say that he started singing a Lady Gaga song during surgery one time. And the lady woke up and was like, how did you know I loved that song? And he was like, oh my gosh, you could hear it.
Really? Wow.
So that was a funny story, but
that's how good he was.
That's not going to be you. You're not going to accidentally sing to them.
No.
Unfortunately.
Not one of my talents.
What is a movie that everybody loves, but you secretly think is a horrible movie?
I recently watched The Breakfast Club, and I didn't hate it, but I just didn't get the.
You're like, I don't get the hype.
I didn't get why it was such a classic, cult classic. I thought it was. This is just within the last probably year. I don't think I'd ever seen it, and I'd heard about it all the time.
Yeah, it's always talked about.
And so I decided I better figure out what this is about, and so I watched it. I didn't get why it was so popular.
Okay, we have one more question for you, and it's a would you rather question. So, would you rather accidentally call your boss mom or dad Or trip in front of an audience right before you're about to give a big presentation.
Oh, man. I would rather trip and fall on my way to
I
to
agree.
give a
I
speech because
think
that'll
that.
be, it's kind of over with.
Yeah.
I think if you call your boss mom or dad, that's going to live with you for
It's-
forever.
Then they'll
Every
know,
time.
like, you
Then they'll
accidentally
know.
see them as, like, a parent figure or something. Or, like, they'll be like, it'll just
It's
make
just
that relationship
awkward.
awkward.
Right.
Yeah.
And I feel like around the office, people would remember that.
But if you
every
trip
time.
and fall before a presentation, people aren't going to make fun of you for that forever. They'll just be like, oh.
Or you could just play it off and be like, wow, that was embarrassing. Well, I guess I'm not scared anymore or whatever.
Yeah.
Or like start doing push-ups and be like, it's like,
Right, you could
Do the
play it
worm.
off.
yeah, I meant to do that.
Yeah.
You could recover.
Yes.
It bugs me because I really wish more doctors were not normal.
But they're all pretty
But they're
normal.
all pretty normal, and you are normal.
Yes. Oh, yes.
I don't think anything that you said really was like red flag.
Yeah.
Or,
Even
like,
with the
weird or-
movie choice. Like, I feel the same way about The Breakfast Club.
Right? Yeah.
Yeah.
It was,
Tell my dad.
It's so I didn't see any red flags or any like crazy stuff from you. So you
Yeah,
are
so you're
normal.
normal.
Great.
And honestly, that's probably good for a surgeon. People don't want their life in the hands of someone who's a crazy person.
yeah.
So
I wouldn't. Yeah.
trust.
Yeah.
Maybe one day we'll get someone who's not normal, but we haven't found them yet.
So, getting into today's topic, it's about breast reductions. Is it considered cosmetic, or can it be something that is medically necessary for a patient?
Most of the time, it's considered reconstructive or insurance covers it. There are some nuances to it. It depends on whether the breast reduction is deemed medically necessary by the physician, by the insurance company. And so if the patient meets a number of different qualifications, then it's covered by insurance and deemed medically necessary.
Okay.
In some cases, the patient either doesn't meet the qualifications or insurance doesn't pay for whatever reason, and then it's deemed to be cosmetic. Usually it has to do with the amount of the tissue that's being removed.
So in order for insurance to cover it, what qualifications does the patient have to meet? And in addition to that, is there any like documentation that they need to provide to the insurance to have it be covered by them?
Every insurance is a little bit different. So depending on a person's individual insurance, they'll have different requirements. In general, there's a few things that almost all insurances require. One is that they have symptoms that are caused by enlarged breasts. Oftentimes it's going to be neck pain, back pain, headaches is common. Sometimes people can get numbness of their hands or their arms. Often women will get rashes underneath the folds of the breast. But any kind of symptoms have to be documented. They have to have tried some kind of non-surgical therapies, and they have to have proof of that. So they have to have gone to someone that's been seen for their back pain or their neck pain. They can have seen a physical therapist for their issues. They can see chiropractor. If they have rashes, they could see a dermatologist or primary care doctor who treats these kinds of things. And they have to have documentation that this hasn't worked. And then as far as documentation goes, if they've seen those kind of providers, those bring those in. Another thing that insurance would require is photos. So that's something that the patient doesn't bring in, but like at our office, we'll take photos of every patient and we submit those to insurance. And then lastly, they require that the surgeon provide an estimate of how much tissue is going to be removed, so how much of the breast will be removed. And depending on the particular patient, it has to be above a certain threshold.
Is that like percentage of the breast tissue or more like weight in terms of grams?
Weight in terms of grams, exactly.
Okay.
Yeah. So it's a certain weight. And again, every insurance is different. There's been some kind of charts created and some scales. There have been some studies done. And so you submit the patient's height and weight, and then usually there's some grams that are associated. And so the estimated weight in grams has to be submitted, and then insurance kind of makes a determination. Depends on those things.
Does BMI affect a patient's eligibility? How does that kind of play into who's going to be eligible for a breast reduction and maybe who's not?
Yeah, it can. So your insurance companies are really variable in what the requirements are. So BMI can be a factor. The last I looked, there was a study done about different insurance companies and what the requirements were, and about a third of them have a BMI requirement. And the meaning is that if their BMI is too high, then they don't qualify. So
Okay.
one I looked at recently was TRICARE is the military insurance TRICARE has a BMI cutoff that the BMI to qualify for breast reduction has to be below a certain number. But like I say, about 30% have that cutoff. A majority don't. The BMI is significantly high and they get a breast reduction, the chances that their symptoms may be resolved are probably lower.
After a woman has gone through a breast reduction surgery, do those symptoms that you talked about earlier typically go away immediately, or is there kind of a downtime recovery period after a breast reduction?
There's a downtime. After the surgery itself, they're still in some degree of pain after surgery and recovering and taking it easy. They may not feel it immediately, but a vast majority of patients have symptom improvement. That's one good thing about reduction surgery is over 90 to 95% of patients have some degree of symptom reduction, whether it's their back pain, their neck pain, their headaches, all those things. High likelihood that their symptoms are going to improve after surgery. It may not occur when they wake up, right in the recovery room, but once they've recovered from everything, a vast majority of patients have improvement in their symptoms.
I don't know if this is the right way to ask this question, but do they choose how much gets reduced, or how's that decided? Is that something the surgeon decides, or do you talk about it with the patient to achieve a certain breast cup size?
Yeah, it's a conversation with the patient and the surgeon. We kind of talk a little bit about what their goals are after surgery, and it's variable and it's individualized on the patient. I tell everybody that no cup size is guaranteed. And that's partly because every bra manufacturer has a different cup size.
Yeah.
So a woman may be a B size in this bra, and they may be another size in a different one. So I never guarantee what their cup size is going to be. But in talking with the patient before surgery, I can usually get a sense of what their goal is. If they want, some women say, look, I want to be as small as possible. This has been bothering me for so many years. And other women might say, I would rather be a D cup, or I don't want to be too small. And some people, say I'd like to be really proportionate to my body. And so it's individualized. It's a discussion between the surgeon and the patient of what's reasonable, and we try to match that as best we can. But a guaranteed size is never totally possible. I should say it's usually not possible to have a guaranteed cup size.
Yeah, I just wasn't sure if that affects their symptoms after as well. Like if they go above or below a certain size, if that affects their recovery of symptoms too.
Yeah, usually when people come in that have these symptoms that are the breast causes these problems for years, usually the surgeon is going to be aggressive enough to try to relieve their symptoms. And usually the patient is okay with that. I rarely would see a patient who's got a lot of problems from it, and they kind of say, I just want a small amount taken off. Usually it hasn't been a problem, in my experience. Yeah.
We've talked a lot about like the before surgery, the qualifications, but I think a lot of people in deciding whether or not to get breast reduction surgery really are interested to know what the process of the actual surgery is. So like how the breast tissue is removed, things like that. And how long does this surgery usually take?
So patients are under general anesthesia, so they're completely asleep for the procedure. Yeah. That usually takes anywhere between 3 and 5 hours or so it takes a fair amount of time. And what basically happens is incisions are made on the breast, and usually there's parts within the breast tissue that's removed. So it's the sides of the breast, so the lateral aspect of the breast, some of the medial, and then after that excess breast tissue is removed, it's sewn back together. The incisions are a little bit variable, but in general, the incisions go around the areola, straight down the middle of the breast, and then underneath the breast and where the breast fold is. If you look it up, some people say it's an inverse T type of incision, or an anchor is what it looks like afterwards, and that's where the scar is, and that's what incisions are made. Usually it's outpatient, meaning you have surgery and you go home the same day. Occasionally, if either the surgery's really long or the patient's the healthiest and has some medical problems, sometimes they'll stay overnight just for observation. But most of the time, they go home the same day. Often a question is if a patient's going to have drains afterwards, so little plastic tubes that go out of the skin. And usually there are not. Okay. Sometimes if there's a couple of reasons that surgeon may leave drains, usually not, though. Usually they don't have to have any drains.
Personal curiosity, when you're removing the breast tissue, Is it like suctioned out, or are you cutting breast tissue out? How does that work?
In some cases, like mostly that's for a small amount of breast tissue that needs to be removed, or usually it's a cosmetic kind of situation. You'll do liposuction, and you can kind of shape the breast in that way. But a majority of patients who are getting a significant breast reduction, it's done with sectioning it out. So using a cautery tool, and you basically take pieces of the breast out. The goal of the procedure is to produce symmetry. You want the breast to be relatively the same size. So, during the procedure, we'll weigh the amount of breast tissue that's coming out, and often we'll sit the patient up and take a look and make sure everything looks as symmetric as possible. A vast majority of patients, male and female, they have some degree of asymmetry. So either one side looks different than the other, or it's bigger or smaller, or there's asymmetry naturally.
I mean, that's how it looks.
Yeah, naturally
anyway.
Yeah, right.
So I think that's a good goal to have, is to make it look as natural as possible. I'm curious, is there a typical age range for patients that get breast reduction surgery?
There probably is a studied age range. I'm not sure exactly what it is. I'd say most of the women I see would be in their kind of 40s to 60s.
Oh, that's shocking.
They've been, kind of considering it for a long time, or those kind of things. But it can be, as early as their adolescence up to, even later in life.
I feel like it makes more sense logically that an older woman might want that. She's been through possibly childbirth and all the other hormones that are associated with that later in life. But what would cause an adolescent to seek out a breast reduction surgery?
Some adolescents just have an exaggerated response to puberty. Extremely large breasts, even at a young age, in their early teens. And so those symptoms can even develop. So symptoms of back pain, neck pain, those kind of things can even develop even as a young teenager. Maybe not a more pressing issue, but one we think about is the social aspects of it. So teens who are really young, who have these large breasts, make it hard to fit in, or they get teased, those kinds of things. And the discussion that just has to be had with adolescents, and the same principle with women who are having these symptoms, but also women who are planning on having children in the future, is if they want to get a breast reduction, either if they're not totally done growing, or if they're planning on having kids, is that they may have recurrence of their symptoms or re-enlargement of their breasts after a reduction. They get a reduction when they're 16, and then they have children later in life. It's certainly possible that their breasts will grow again, and they may have recurrence. So at least they need to understand that
that's a possible
it's
risk.
a possibility. Yep. So in an ideal world, you would have a breast reduction after you're done with kids, done growing, and the breasts are pretty stable.
Does it affect your ability to breastfeed, or?
It can affect a woman's ability to breastfeed.
Okay.
Yep. They've done some studies. They've shown that usually upwards of 70 or 60 to 70% of women who've had a breast reduction can still breastfeed, but it may decrease their ability to do so.
I was going to say, isn't it kind of hard to run a study like that, because each pregnancy is different too, and how mother and child work together with breastfeeding? So I feel like that's kind of a hard study to do accurately.
Right.
Yeah.
I agree. Yeah, it would be a hard study to do for all those reasons, and because there's a certain percentage of women who just can't breastfeed. It's their anatomy, and it's nothing they did wrong or nothing that happened. It just they just don't breastfeed, and so it's a hard study to do.
One of the questions that we had asked on social media was, does a breast reduction surgery affect your risk of breast cancer?
It does decrease it slightly.
Oh, it actually decreases it?
Yeah, and that's mainly a function of having less breast tissue, and so less tissue to have cancer in it. But it wouldn't be an operation that would be recommended for that purpose.
Like if you have that breast cancer gene, this wouldn't be the surgery for that.
Exactly.
Okay.
Yeah. It's not a surgery that's designed, it doesn't serve a purpose to decrease your risk of breast cancer. People have asked also if it increases your risk of breast cancer, and the answer to that is no. I've never heard or read anything about it increasing the risk of breast cancer either. So probably reduces it slightly, not significantly enough where, a woman can stop having mammograms or something like that. Even after reduction surgery, a woman should still have her typical screening for breast cancer. So mammograms or whatever imaging she did before, she continue those because the risk is still there.
And you should always get your screening mammogram.
You should.
Yes.
Yearly.
That is,
Yearly, once you hit that age.
Yes.
Yes.
Always.
Or if you're a higher risk, you might need to start earlier. So going back to the surgical aspect of breast reduction, what are, for the people wanting to or are interested in getting breast reduction surgery, what are some of the risks or complications that can occur during surgery?
Anytime you cut the skin or risks of surgery, you're always at risk of bleeding. Mm-hmm. There's a risk of infection. People do have some degree of post-op pain. And then probably the most common risk of a breast reduction surgery is what we call delayed wound healing, or it's possible that they develop a wound or the skin pulls apart for a part of the breast. And that's usually treated with some dressing changes. Usually after a couple of weeks, it heals back in. It can be a challenge. It can be a problem. And that's probably the most common. Probably the most, challenging complication to deal with is when the areola and the nipple become necrotic, or they lose the blood supply to them and it turns black and basically becomes a scar. Nobody wants that. That's cosmetically doesn't look very good. So that's another rare complication. A majority of a breast reduction surgery is to prevent that from happening, try to preserve blood flow to the areola, but that can occasionally and rarely happen.
You talked a little bit about nipples and if they could have some complications with surgery. Is there a risk of loss of sensation after a breast reduction? And if so, is it usually temporary?
Yes, patients can experience a change in sensation of not only the areola and the nipples, but other places on the breast that have had surgery. Typically, it's a small number of patients, usually 5 to 25%, so up to a fourth of patients. And majority of time, it's temporary. So majority of time, it comes back to normal. Small percentage of patients who it's permanent. And that can be anywhere from either a complete loss of sensation, so their nipple is completely numb, or on the opposite, it could be hypersensitive, so it's more sensitive than it was before, and kind of anywhere in between. But like I said, a majority of the patients don't have an issue, and of those that do, a majority of those regain their sensation.
After surgery, what does the process of recovery look like for women who are, going home and recovering for this? Is there like any sort of compression involved? Do they have to wear certain types of bras going forward? What does their recovery look like?
Typically, I'll tell patients to plan on taking it easy for at least 1 to 2 weeks, and probably staying away from work, depending on what they do for a job. So that entails go home, kind of hanging out on the couch. They can walk, they can go up and down stairs. That's not a problem, but no strenuous activities, no exercising, not a whole lot, but beside taking it easy for at least the first couple of weeks. As far as compression and bra wear and stuff like that, so I recommend patients wear some type of compressive bra for at least 2 to 3 months after surgery. Okay. The reason for that is there's going to be some swelling, there's going to be some risk of fluid collecting underneath the skin for some time. Mm-hmm. And so I recommend they wear compression for at least 2 to 3 months. Usually they'll leave the hospital with the compressive type bra, and then they can wear that, but they could also get a sports bra as something that a lot of patients will want to get.
Yeah.
Hard to buy it before surgery because they don't know what size they're going to need. What I tell folks is after a couple of weeks using these surgical bras, they could start to get an idea of what kind of compressive bra they would like. Usually, I'll tell them to avoid a bra with an underwire, which may be uncomfortable because that's where the incision is.
I don't even like those now.
Yeah.
So can't imagine after surgery.
The good part about compressive garments after surgery is they also feel better. People tend to feel like it's kind of cozy and it's giving a little bit of pressure to the area. So, and if they work a desk job or work from home and they don't want to take off that much time, I typically say there's no problem with rolling out of bed and typing on your desk or something. That's not a problem. But if they're doing a job that requires a little bit more activity, they may have to take a couple of weeks off of work. As far as exercising and more rigorous activities, have people wait at least a month or so before they get back to more physical cardio activity.
Yeah.
And then hopefully if everything goes well by 6 weeks, they're usually back to almost whatever they want to do.
What does that look like with water-based things, whether that's taking a bath, sitting in a hot tub, swimming, going in a lake? Are there certain things they have to avoid after surgery and for a certain amount of time?
We women can shower typically between 48 and 72 hours. So you usually can shower within a couple of days after surgery. But I recommend they don't do any swimming, hot tubs, submerging the wounds at least for a couple of weeks and until everything's healed and they're clearly healing well.
Do women usually talk to you about like the pain levels that they experience after surgery? Are they experiencing a lot of pain, or do they say it's like pretty tolerable levels, or what do women say to you about that?
Most women are surprised about how little pain they feel. Now, there's always the exceptions of someone who had more pain than expected, but a majority of women come in for their first follow-up visit and they're like, oh, it wasn't as bad as I thought it was going to be. So I always inject some numbing medicine at the end of the surgery and then give several medications that work in different ways to try to decrease the pain as much as we can. So I've been pretty pleased with how well people do pain-wise.
That's good to know. I think a lot of people will be interested to know that because
pain
pain is scary to people.
Yeah. Oh, it's always a worry.
Yeah.
That's how, and maybe that's a deterrent for some folks is I don't want this surgery because it's going to be too painful.
Like the surgery itself, like you're out for that. So it's not probably as scary as like what you're going to deal with afterwards.
Right.
So
at home is when you're worried that
Yeah.
you don't want to get too bad.
So just as a closing question, kind of overarching, have you found that women who've decided to go through this breast reduction process and the surgery, did they meet their goals of what they wanted from a breast reduction surgery?
The satisfaction rate is definitely high as far as surgeries go. And in the realm of plastic surgery, it's thought to be one of the higher rates of satisfaction. They've done some studies with it and show it as high as 97% of patients are satisfied with the surgery and would do it again. Many patients increase their activities afterwards. So it'd be upwards of 70% or even more report that they're able to do activities they otherwise weren't able to do. So a lot of women have been thinking about this for a long time, but they haven't wanted to see their provider, or they didn't think they were a candidate, or they just were embarrassed about it. And so part of the reason the satisfaction rate's high is because people have been considering it for a long time and they're finally doing it.
Well, I just want to thank Dr. Williams for coming on the podcast today. We've learned so much. I always say that, but we always do. And I feel like if you're someone who is interested in breast reduction surgery or any other reconstructive surgeries, Dr. Williams is your guy, your go-to guy. He is so knowledgeable in every aspect. And I think we could see that today, all the knowledge that you can bring to the table. And I think if that's something that you're interested in, make an appointment, talk it over with him and see if that is something that could benefit you potentially. Please follow us on our social medias. We are always posting questions about our future episodes. So if you want to put your input in, we can ask your question to the next provider that we have on the show. And we will see you next time.
Disclaimer. The information shared in this podcast is for general informational purposes only and should not be considered medical advice. While our podcast will provide helpful suggestions and insights, every individual's health situation is unique. For specific medical advice, diagnosis, or treatment, please contact your personal healthcare provider.